Health risks of childhood obesity. Child health and obesity. Obese children are more likely to be ill, be absent from school due to illness, experience health-related limitations and require more medical care than normal weight children. Overweight and obese children are also more likely to become obese adults, and have a higher risk of morbidity, disability and premature mortality in adulthood. The table below provides a summary of recent evidence on some of the main obesity-related conditions that can develop during childhood and adolescence. Type 2 diabetes. Type 2 diabetes usually appears in adults, but recently more children in the UK are being diagnosed with the condition, some as young as 7. A surveillance program of children under 17 in the UK found that 95% of those diagnosed with type 2 diabetes were overweight and 83% obese. Type 2 diabetes was found to be increasing, with children from minority ethnic groups at higher risk than white children. In the US, analysis of the National Health and Nutrition Examination Survey 2005-2006 found that the prediabetes rate of overweight adolescents was 2.6 times higher than those with normal weight. Recent analysis of the National Longitudinal Study of Adolescent Health found that diabetes risk was particularly high in adults who were obese as adolescents compared to those with adult-onset obesity. Asthma. A recent meta-analysis concluded that overweight and obese children are at a 40 to 50% increased risk of asthma compared to normal weight children. In the US, analysis of data from the National Survey of Children's Health, NSCH, showed that 19.7% of children aged 10-17 with asthma were obese compared to 12.2% of children without a chronic condition. A further US study of adolescents with disabilities aged 12 to 18 found a significantly higher prevalence of asthma in overweight adolescents with non-mobility restrictions compared to their healthy weight counterparts, 25.2% compared to 16.6%. Results from a recent large, longitudinal study of children and young people aged 6 to 19 years suggest that a higher BMI contributes to asthma development and may also lead to more severe asthma. Findings from the analysis of data from 8 European birth cohorts suggest there may be a causal link between obesity and asthma in children, with rapid growth in BMI during the first 2 years of life increasing the risk of asthma up to age 6 years. Obstructive sleep apnea, OSA. A recent review on childhood obesity and obstructive sleep apnea, OSA, reported that the prevalence of OSA among obese children and adolescents could be as high as 60%. A study of children with sleep disturbances in Taiwan found that the risk of having OSA was significantly higher in severely obese children than that of normal weight children. Cardiovascular, CVD. Risk factors. In the Bogalusa Heart Study in the US, 70% of obese 5 to 17-year-olds were found to have at least one risk factor for cardiovascular disease, CVD, for example high cholesterol levels, high blood pressure and abnormal glucose tolerance. A nationwide surveillance study in the Netherlands recently reported that 62% of young, less than or equal to 12 years of age, severely obese children already had one or more CVD risk factors. A recent cohort study in the US found that childhood obesity is associated with a quadrupled risk of adult hypertension. 26% of obese children had hypertension as adults compared to 6% of normal weight children. A recent review concluded that childhood obesity not only increases cardiovascular risk in adulthood, but it is also associated with cardiovascular damage during childhood. Psychosocial risks / mental health disorders. There are conflicting views on the association between obesity and depression or low self-esteem in children. However, there is strong evidence to suggest that by adolescence, there is increased risk of low self-regard and impaired quality of life in obese individuals. Factors associated with mental health problems in obese children include lower levels of physical activity, low self-esteem, body dissatisfaction, eating disorders and weight-based teasing. Recent findings from the Millennium Cohort study suggest that childhood obesity may be associated with emotional and behavioral problems from a very young age, with obese boys at particular risk. Musculoskeletal problems. Excess weight can lead to increased stress on the musculoskeletal system. The most common orthopedic problems in children include tibia vara, Blount's disease, and slipped capital femoral epiphyses resulting from the impact of increased weight on the developing skeletal system. A recent systematic review concluded that overweight and obesity are related with various musculoskeletal complaints in childhood. Musculoskeletal pain was found to be significantly higher in overweight children than in normal weight children. In the UK, obese 17-year-olds from the Avon longitudinal study of parents and children were more likely to report musculoskeletal pain, including knee pain, as well as more severe pain than their non-obese counterparts. An Australian study of 10 to 13-year-olds found that obesity led to impaired physical health-related quality of life and activity restrictions such as walking and climbing stairs. In a large study of Dutch children aged 2 to 17 years, overweight and obese children reported musculoskeletal problems and lower extremity problems more frequently than their normal weight peers. Ankle and foot problems were significantly more common in overweight and obese children compared with normal weight children. Thanks for watching. Do subscribe to our channel to know more about childhood obesity.